Lecture for the first day of class. So we're going to do endocrine system review. I know that this has been a lot, but like I said, it should be reviewed, so it shouldn't be terrible. So we've really only got three things that we're going to go through briefly here. We're going to just talk about how the endocrine system regulates blood glucose, water and salt balance, and blood pressure. So we've got insulin and glucagon, and they do opposite things. So if blood sugar is higher than normal, that's sensed by beta cells. The beta cells in the pancreas release insulin. Insulin targets liver, fat, and muscle, and it basically opens glucose stores, so glucose can be taken from the bloodstream up into liver, fat, and muscle. Blood glucose goes back to normal. Okay. Conversely, if blood glucose is low, glucagon is released by the pancreas. This goes to the liver specifically and causes the breakdown of glycogen. And glycogen is just a bunch of glucose molecules that's released. That being glucose is released into the bloodstream. Glucose goes back up to normal. Okay, and we'll get into this more in a couple weeks as well. Then we've got control of blood pressure, salt, and water concentration. They're all kind of lumped together here. And so this is where we get the renin, angiotensin, aldosterone system. So if we've got low blood pressure, that's going to be sensed by baroreceptors, and this ultimately will cause a lot of things, one of which is the release of renin. Okay, and so when we release renin, what happens is it ultimately causes the release of, or activation is a better word, of angiotensin 2. Angiotensin 2 does four things. It causes vasoconstriction, the release of aldosterone, the release of ADH or vasopressin, and causes you to get thirsty. All of these things will ultimately lead to an increase in blood pressure. Aldosterone also causes us to increase sodium reabsorption, so we increase sodium concentration. Antidiuretic hormone or vasopressin also causes us to hold on to water. Okay. Generally speaking, if we hold on to salt, we hold on to water. Wherever there's salt, water will follow. Okay. So to see this in words, you've got this here. So renin activates or converts angiotensinogen into angiotensin 1. That will reach the lungs, where it's then converted into angiotensin 2. It does those four things that I just talked about, and we ultimately increase blood pressure. We've also got the baroreceptor reflex that will occur if I've got high or low blood pressure. So in this case, if I've got high blood pressure, I will reduce sympathetic output, increase parasympathetic output. Notice that the sympathetic system affects vasoconstriction or dilation, stroke volume via force of contraction, so I'm going to put SV here for stroke volume, as well as heart rate. Parasympathetic side, however, only affects heart rate. So if I have high blood pressure, I want to cause vasodilation, low stroke volume, low heart rate, which will lower resistance, and cardiac output, which will lead to a decrease in pressure. Remember that the opposite is true if I have low blood pressure. So hormones that are involved, epi and norepi. Epi causes vasoconstriction, which will increase resistance and then increase pressure. Norepinephrine increases heart rate and stroke volume, which will increase pressure. Angiotensin 2 causes vasoconstriction, which will also increase blood pressure. When it comes to blood volume, angiotensin 2 causes us to hold on to salt, which will cause us to hold on to water, which will increase our blood volume. Aldosterone causes us to hold on to salt, which causes us to hold on to water, which will increase blood volume. ADH causes us to hold on to water, which causes an increase in blood volume. And then we've got something called ANP, or atrial natriuretic peptide, or ANP. This actually causes us to get rid of salt, which means we will get rid of water, which means we'll have a lower than normal blood volume. And so that is just a quick review of the endocrine system.